This is Dr. Mohammed Qureshi, and today we're going to talk about the relationship between the pressure, airflow, and resistance. We're talking about the physiology of the lung, and we're going to talk about the relationship between the pressure, airflow, and the resistance that the air faces when it passes through the lungs and the systems involved into it. So, first we're going to talk about the airflow. What is an airflow? Flow, like in any physical object, is basically the pressure difference from a point A to B. So if there is a pressure difference from this point, and at this point the pressure is lesser and there is greater, then the pressure from the flow would be from higher pressure to lower side. That is usually the flow of the gradient. So in case of the respiratory system, in the respiratory physiology, the flow would always be the pressure differences between the alveoli and the pressure in the mouth or nose, or the pressure in the atmosphere, right? So whatever the difference is, for example, if you are inspiring in, you're doing the inspiration, at that time there is a negative pressure in the alveoli because of the expansion that has happened, because the more negative pressure was developed into the intrapleural space when the chest cavity was expanding, and that expanded the lung, and now there is a negative pressure inside the alveoli then as compared to what is in the atmospheric pressure. So this pressure difference will cause the air to surge in, and there will be the flow. So flow is directly proportional to that gradient of the pressure. The greater the pressure would be, if you have more expansion, you have expanded your cavity more, the greater the differences and greater the flow would towards the alveoli, right? And one thing which it is inversely proportional to is the radius, is the resistance. The word is resistance. So whatever resistance is being provided by the airways will hinder that flow. So the flow is inversely proportional to the resistance there, right? So if we sum it up, we say that flow is directly proportional to the pressure gradient between the alveoli and the air, and it is inversely proportional to the resistance provided by it. So what is the resistance there, and how would you define what are the things that can cause the resistance in the airflow? There is this is interesting actually, because we know in the physics we have learned that Poiseuilles law has taught us few things that we already know. Now I tell you, there is a formula that is written in like R 8 naught L pi over R 4 bar 4, but that is not important here. What I want to tell you, what formula tells you. The formula tells you that the resistance is directly proportional to the viscosity of the air. So if the air is more viscous, it's dense, it is going to cause more resistance. A very good example is in the when the sea divers, they go beneath the sea, then the pressure of the atmospheric pressure on them plus the water underneath they have gone, the water pressure is too much, so the air they bring with them, they become very dense. That dense air is difficult to pass through the airways because it is very heavy, it's liquefied. So the greater the viscosity of the air inhaled, the greater the resistance is going to be. That's what the Poiseuilles law already tell us. Poiseuilles law also tell us that it is the length of the airway. The resistance is more if the airway is long, and resistance is less if the airway is short. For example, if this much amount, if the tube is only this way, airway, the air goes from this side and go out from that side. This is a little, this is the length of it, then it will cause lesser resistance. But if it is longer, this much, it will cause the greater resistance to it. And as in context with the respiratory system, I think the lengths are fixed, right? The anatomical lengths are fixed, so that won't hinder much. And it is inversely proportional to the force power of the radius. That is very important, because it says like it is inversely proportional to the force power of the radius. If you increase resistance to 1 unit, it will decrease in the fourth power. For example, if I say that the resistance has decreased 4 units, for example, if I say that the radius is decreased 4 units, any 4 units, then the resistance would increase 4 raised to power 4, that is 256%. So 256 points, it will raise 256 points, so that is very huge. So it is also similar in the cardiovascular system. When you talk about the resistance there, you will know that the airways, the bronchioles and the alveoli and the vascular system, they have the similar sort of resistance which is present. So Poiseuilles' law tells us that the resistance is directly proportional to the viscosity of the air, and it is directly proportional to the length of the airway, and it is inversely proportional to the fourth power of the radius. That's what we already know. For that you do not need a medical system. That happens anywhere when there are pipes are. But what is special to respiratory system there? So we know that in respiratory system there are certain factors that can change the resistance even more. Now what are those factors? Those factors are sympathetic system and parasympathetic system. Because sympathetic, here the radius is changeable, because the bronchoconstriction can reduce the radius and bronchodilation can actually increase the radius. So if the sympathetic system is involved, the sympathetic system is acted by the beta 2 agonists, and beta 2 agonists, which are basically the Ventolin that we use for nebulization usually, that will open up the airway by the sympathetic activity. And if the parasympathetic system is on, the bronchoconstriction is done by the contraction of the bronchial smooth muscles. So that is very important, the factor that will cause the resistance. So with the bronchoconstriction and with the bronchodilation, you would mostly enhance or reduce the resistance, and that would either increase or decrease the flow of the air to the lungs. That is a very important thing that we need to know. Another thing is the lung volume. So we know what are the lung volumes. We have learned about the tidal volume, then we have learned about the expiratory reserve volume, inspiratory reserve volume, and the residual volume. But here, lung volume, we just talk about the tidal volume, right? So there is a phenomenon known as the radial traction. Radial around traction. So what is that radial traction? When you talk about a small alveoli, they do not have cartilages in their walls, so they do, you know what, in the trachea, the trachea cannot be collapsed because there is C-shaped cartilages there. But as it goes to divide further and further and further, the trachea, the cartilage is gone, then they are prone to collapse, right? So when at the lung at the low volume, when you breathe the lower volume, there is a tendency of the alveoli to collapse. Why? Because when the lung expanded, the connective tissue around it pulls everything apart, and if it is the alveoli, then there is a force outward, and that expansion causes a radial traction. That traction, because if the lung is expanding, if you look at the small alveoli there, with every expansion there is a traction outward, and this traction keep it open. So when you have a higher volume, like if I breathe in, like with a higher volume, the traction would be more, and this more traction would further increase the radius there, and that increasing of the radius will reduce the resistance, right? So a higher lung volume, if you breathe with the higher lung volume, like deep breathing like that, there is lesser resistance. This is of the importance in the patient with the asthma and COPD, because there is obstructive lung diseases and there is huge resistance when they breathe in or breathe out. So they learn to breathe in the higher volumes. So you won't see somebody with the COPD breathing like, and with a slow volume, like they always breathe like. So they have learned to breathe with the high volumes to increase the radial traction in order to decrease the resistance, in order to increase the flow of the blood, and obviously the blood viscosity has a role in it. So if I just sum it up, I would say the airflow to my lungs is dependent upon the pressure difference between the alveoli present in my lung and the pressure present in my mouth or nose or the atmosphere we're talking about. It is inversely proportional to the resistance provided in my airway. This resistance depends upon the viscosity of the air. If it is higher, the resistance will be more. It depends upon the normal length of the airway. It does inversely proportional to, it depends on the radius of my airways. So if the radius is bigger, the resistance is less. If the radius is smaller, the resistance is more. It also, this radius is controlled by what? Is by bronchoconstriction and bronchodilation, by sympathetic and parasympathetic nervous systems. And also the radius is somehow affected by the radial traction, which is done by the volumes I inspire in or inspire out. If I inspire more air and more volume, then the traction will be more and there will be lesser resistance involved. And obviously it depends upon the viscosity of the air. So if I am having a lighter air, there's going to be a lesser resistance, and if I do the heavier air, there's going to be more resistance. That's all about the air flow, pressure and resistance about the lungs from the lung physiology. Thank you.